we're going to start off by covering something called the femoral triangle. And understanding what makes up the femoral triangle and what is found in it is really going to help you out when you're looking at a cadaver. So the borders of the femoral triangle are going to be the inguinal ligament will be the superior border. The lateral border will be sartorius muscle, and then the medial border will be the adductor longus. Muscles we're going to find in the femoral triangle are the iliopsoas and the pectineus muscle. The nerve we're going to find in femoral triangle is femoral nerve, which is going to be lateral in this group of vessels. The blood vessels are going to be the femoral artery and the femoral vein, and the femoral vein will be the most medial. So taking a look here, in this picture, the femoral triangle, the borders are colored in purple. So that superior border right here is that inguinal ligament, which goes from the anterior superior iliac spine all the way over to the pubis bone. The medial border is this adductor longus. And then sartorius makes up the lateral border. So there is the outline of our femoral triangle. Now in green is going to be the iliopsoas, which is found in the top corner. In the medial corner, we find pectineus muscle. And then we have our femoral vein or femoral nav, but that stands for femoral vein, which will be the most medial here. Femoral arteries in the middle, and then the nerve is out here on the lateral side. Now, in reality, this is a little closer to what it's going to look like, but as long as you understand what the femoral triangle is and what's found in it and what makes up it, you can get a lot of points just from that. So starting with our border, we have our inguinal ligament up here at the top. Adductor longus is going to be our medial border. And then our lateral border will be sartorius. So there is our triangle, just like so. That's 3 things total. Now our superior muscle up here is going to be that iliopsoas, which we find in that top corner. And then pectineus is going to be in the medial corner. So that puts us at 5 things. And then our femoral vein. So femoral vein, the most medial, femoral artery in the middle, and then the femoral nerve on the lateral side. So there's 8 total things just by knowing that femoral triangle. You can get 8 points right there. So it's a really important thing to understand and know what's going on in there. That way, when you get to the cadaver, you can navigate around some landmarks. Now, starting on the arteries of the lower extremity, we're going to do a quick posterior drawing, just a really fast, simple sketch of all of these. So I'm drawing the major highway we're going to have in our exits are going to be, there's our first one. Then we'll have 2 more, just like so. So where we start is the femoral artery. And that is actually going to run straight down the leg until we get to right here. So just naturally, the artery is actually going to go through the adductor hiatus, which is a hole that allows the artery to pass to the posterior side of the body, because we're calling that femoral triangle, we're looking at the anterior hip. So this artery is going to dive down and run between the 2 condyles in that intercondylar fossa of the femur. And so when it does that, it's actually going through a different region. So with arteries and veins, when they get to a different region, we call them a different name. So at this point, this dotted line, that is going to be the popliteal arteries, as is located behind the knee. Now, just after it exits from the popliteal region, this entire structure is the posterior tibial artery. So posterior tibial artery, you can actually catch a pulse on this if you are feeling your medial malleolus of your tibia. If you go just about an inch posterior and just a little bit inferior, you'll feel a pulse, and that is actually your posterior tibial artery, and that will tell you how blood is flowing to the bottom of the foot.